بسم الله الرحمن الرحيم. أبناء الطلاب وزملاء أطباء الدراسات العليا، يسعدني أن أقدم لكم هذه الأفلام التعليمية التي تتناول الجانب العملي لمادة التشريح. فلنشاهد الآن هذا الشريط على أمل أن يحقق الفائدة المرجوة منه مع تمنياتي لكم بالتوفيق. يقول الله تعالى: وقل اعملوا فسيرى الله عملكم ورسوله والمؤمنون. صدق الله العظيم.
The scalp. This is the scalp. The scalp is the covering soft tissue of the skull cap. It consists of skin, superficial fascia, epicranial aponeurosis, loose connective tissue layer, and the periosteum of the skull cap, called the pericranium. The three superficial layers, namely the skin, superficial fascia, and epicranial aponeurosis, are firmly fused together. This is the epicranial aponeurosis, which extends between the frontal bellies and the occipital bellies of the occipitofrontalis muscle. This is the layer of loose connective tissue just deep to the epicranial aponeurosis. This space allows easy spread of infection and accumulation of fluid, so it's called the dangerous area of the scalp. This aponeurosis is attached laterally to the temporal line, while anteriorly and posteriorly it gives attachment to the frontal bellies and occipital bellies of the occipitofrontalis muscle. These are the muscle fibers of the frontal bellies intermingling with the fibers of the orbicularis oculi muscle. It should be noted that the frontal belly is inserted into the skin of the forehead, and that the whole occipitofrontalis muscle is supplied by the facial nerve. The frontal belly by the temporal branch, and the occipital belly by the posterior auricular branch. This is the supraorbital artery, accompanied by the supraorbital nerve. Medial to these structures, the supratrochlear artery and nerves lie. Note that the supraorbital and the supratrochlear arteries are branches of the ophthalmic artery, which arises from the internal carotid artery. The corresponding nerves are branches of the frontal branch of the ophthalmic nerve. These are the supratrochlear and supraorbital veins, which form the beginning of the facial vein. They communicate with the ophthalmic vein, which drains into the cavernous sinus inside the cranial cavity. This is the left occipital belly of the occipitofrontalis muscle. It arises from the lateral part of the superior nuchal line. This is the occipital artery, which is a branch of the external carotid artery. It's accompanied in the scalp by the greater occipital nerve, which